Young lady, are you absolutely sure you want to consider this kind of procedure for your breasts?
Yes, I want to get breast implants.
What? Questionable medical practices, unusual growths, and planetarium pandemonium.
Planetarium!
Today we're back at it, breaking down and reacting to all of the over-the-top medical scenes and thought-provoking injuries from South Park. Let's dive right in.
You think HIV is something to be laughed at, Kyle? Well, let's just see how funny it is now.
What?
What?
What is HIV? The human immunodeficiency virus. It's transmitted through blood, not typically bodily secretions like saliva. It's called a bloodborne pathogen. Put it in Kyle's mouth. If you swallow it, can you get it? Probably unlikely. But if there's any open areas because of the mucosa, if there's a cut and it can get into your bloodstream that way, then yes, there is a chance that you can actually get infected that way.
There, Bubby, you'll be okay. Oh, doctor, did you find anything? Is it strep?
No, it isn't strep.
Oh, well, that's a relief.
HIV is a virus that attacks our immune systems, the human immune system, runs it down so much that then we increase the risk of having other infections, opportunistic infections, that when our systems are down, they can come and harm us and potentially take our lives.
Mrs. Brovlowski, has your son ever had a blood transfusion?
No, why?
Little boy, have you been having unprotected anal sex?
What? No! Doctor, what are you saying?
Typically, ways of people getting HIV transmitted is blood transfusion, sexually transmitted, meaning not just anal sex.
We've run every test imaginable. Little Kyle here is infected with HIV.
Whoa. The concern is it's a virus, so there's not a lot of treatment for it. We have a lot of different medications out there to suppress the virus enough to where it's maybe not detectable and not affecting our body, but there's no way to specifically eradicate it that we know of yet.
What?
HIV?
It took us a long time to narrow it down, but there is no doubt.
No, that's impossible.
So doctors saying, hey, it took a long time because, again, kind of vague symptoms of a virus. It could be so many different viruses. At the beginning of the COVID pandemic, the panel for testing viruses was just huge. Now we've narrowed it down.
Young lady, are you absolutely sure you want to consider this kind of procedure for your breasts?
Yes, I want to get breast implants.
What? There are cosmetic procedures that are done to the pediatric population or anybody below the age of 18, but typically it's related to anything that would fix a potential like disfigurement. A classic example would be a cleft palate.
I tried to tell her she was too young.
Well, it is a different time, Mrs. Testaberger. Society puts a lot of pressure on your daughter to look her best. Having small breasts can make her feel unimportant.
But she's 8.
Yes, well, not too young to feel flat and therefore not pretty.
8 years old, not even potentially going through puberty yet. As we go through puberty, our bodies do change, and it takes many years, actually. In the United States, parental consent is required for any cosmetic surgeries for any individual below the age of 18.
However, young lady, I'm afraid breast implants are not for everyone. I'll need to carefully assess your physical and mental condition to see if augmentation is truly the best way for you to go.
I have $3,000 cash.
You pass, let's do this thing.
Oh my God, that is horrible. No. I know there are doctors out there that do a lot of cosmetic surgery. They won't do surgeries until they maybe have had a psychiatric assessment to make sure that they understand the consequences of what they're doing and they've thought this out.
What we do is make a small incision in the armpit where it won't be seen. Then we take this little plastic bag and gently place it in the chest where we fill it with salt water.
The surgeon is giving the ease of the procedure to ease the patient as well as the patient's family member. But you also have to discuss the consequences, the risks, all aspects of surgery. That way you know what potentially could happen. Oh my gosh. Oh my gosh. And look what happened. This is just awful. The tissue is not stretched. It's not able to expand that fast. If I eat tons and tons of calories, my body's going to expand, but my skin does need to stretch because of the different components within the tissue.
Whoa, dude, who the hell are you? Mr. Garrison, there's some freaky kid from the planetarium on our bus.
We better get him to the nurse's office. Stay.
Yep. Bring to the nurse's office, maybe acting a little erratic, confused, but then also sweating. The differential diagnosis could be multiple different things, including infection around the brain. Fevers can do this. Fever. Unlikely delirium. Medications can do this. Seizures.
I'll give him a painkiller. That should calm him down.
No.
The individual is being restrained. This actually happens a lot in the emergency department for many different reasons, medical reasons, illegal substance reasons, and our ultimate job is the protection of that individual.
He's stable, but I still can't get any information out of him. I'm going to sedate him now.
No drugs.
Drugs are good, okay?
The appropriate standard of care that we would typically do for somebody in this state. You don't just do everything under the sun. You try to get in touch with the parents. You discuss the presentation of the individual and say, okay, this is our plan. This is what we're going to do.
Don't let them go. Planetarium.
Oh, why, Van Gelder?
The machine.
He's been talking about the machine for hours.
Okay, wait a minute. The nurse looks like it has fetus in fetu, but it looks like this nurse in this clip has left that appendage still there.
There's only one way to get any sense out of him. We're gonna have to try a mind meld.
A mind meld? I don't know what that is.
One and together.
You try to talk to them. You try to do a lot of things before you do sedation. And again, you want to make sure the medications are not going to interact with anything that they might be taking or make them worse.
Yes, I'm afraid you're a little sick, but it's okay. Because together we're going to get you well.
Don't listen to Dr. Janice. He's a mean old man and a big silly grown-up.
Pardon me?
He's just a big old stick in the mud who doesn't like to play.
Looks like maybe the doctor has his own medical issues.
You've got a condition.
What we used to call multiple personality disorder is now actually called dissociative identity disorder.
Don't mind him, Butters. Billy's a pretty messed up kid. He was molested by his uncle, you see.
Dr. Janus isn't going to be alive for long. I'm going to kill him.
Now, what are the things that make you happy, Butters?
Doctors are human beings too, and they can have multiple medical problems going on, psychological issues going on. They might be a patient just as much. The most important thing is that the doctor's own medical conditions are not interfering or inhibiting the appropriate care for other individuals.
Your son is suffering from multiple personality disorder.
What?
From what I gather, he seems to mostly jump in and out of personalities when he's outside playing. Sometimes he's a cowboy, and other times he's an Indian. And the two seem to be at constant odds.
Oh, poor Butters.
Oh my gosh. So he's literally describing like a normal kid. Typically, if there is something that we would identify as abnormal, you don't just jump to medications first. Sometimes you can do different types of therapy. Throwing a kid or a pediatric patient immediately on medications doesn't seem appropriate in this setting. South Park, always good. If you guys enjoyed this, definitely check out this playlist right here. And as always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.